Imagine for a moment that a modern hospital is a human body. It's a classic analogy, I know, but stick with me.
It's a good one, though.
It really works. You've got the doctors, the nurses, they're the hands, the heart, doing all the tangible, life-saving work.
Right.
The building itself, the beds, the surgical suites. That's the skeleton holding it all up. But the big question is, what's the brain? What's the nervous system?
And without that nervous system, the hands are just, well, twitching. They don't know what to do.
Exactly. What's the thing that remembers a patient's allergy from 10 years ago and tells the pharmacy, hey, don't use this drug? Because if that signal gets crossed...
The whole system fails. And that's exactly where we're going today. We are talking about that invisible digital infrastructure, the Hospital Information System, or HIIS.
Which you have to admit is probably the driest name possible for something so important. Hospital Information System.
It does lack a certain flair, doesn't it? But trust us, this is the absolute backbone of modern healthcare. If this system goes down, a hospital basically grinds to a halt.
So today we are doing a deep dive into the Global Hospital Information Systems market forecast to 2030. We've been through the reports to figure out how this tech is changing everything for you as a patient. And frankly, the numbers are staggering.
They really are.
I want to understand how software is changing my doctor's visit, but you've crunched the numbers, so give us the headline.
The headline is explosive growth. I mean, we are looking at a market that is fundamentally rewiring global healthcare. In 2024, the market size is sitting at around $63.8 billion US dollars.
Okay, $63.8 billion. That's a huge number on its own.
It is. But by 2030, that number is projected to hit $116.75 billion.
Whoa. So wait, you're saying it's nearly doubling in just 6 years?
We're talking about almost doubling the market size. It represents a compound annual growth rate, a CAGR of 10.6%.
And for a market this size, 10.6% that's not just healthy growth, that's a massive shift.
It's a structural transformation.
Right.
Money is pouring in because hospitals know they simply cannot survive the next decade on the technology of the last one.
Okay, let's unpack that. Because when I hear HS, I just think of my doctor, staring at a screen, typing away while I'm talking. Is that all we're talking about? Electronic health records?
That's the most common misconception. And it's an important one to clear up because it really minimizes the scope. The EHR, the electronic record, that's just the interface. That's the part you see.
Like tip of the iceberg.
Exactly. The report defines HIS as a comprehensive integrated software solution. The key words are comprehensive and integrated. It's not just medical. It's administrative, it's financial, it's even legal.
So it's not just storing my x-rays, it's also running the billing department.
It's running everything. The goal is to break down these old silos. The pharmacy used to have its system, the lab had another, billing had a third, and none of them talk to each other.
Which sounds like a recipe for constant errors.
It was a total disaster waiting to happen.
Yeah.
HIIS brings it all together. Yes, it has the patient records, but it also has things like clinical decision support systems.
Okay, what does that mean? Is the computer making diagnoses?
Not exactly. It's more like a super-powered assistant. It can flag potential drug interactions or suggest possible diagnoses based on symptoms and lab results for the doctor to review.
So it's a safety net.
A very smart safety net. And it includes revenue cycle management, which is the fancy term for making sure the hospital actually gets paid. It's the whole ecosystem. Supply chain, pharmacy, telehealth, everything.
Right. The nervous system, the right hand actually knows what the left hand is doing.
And in a hospital, when things fall through the cracks, it's not just an inconvenience, it can be a life or death situation.
Okay, so this is the operating system for the entire hospital. Let's get back to that 10.6% growth rate. What's pouring fuel on this fire? It can't just be about getting rid of old paper files.
No, the death of paper is old news for most big hospitals. The growth now is driven by, I'd say, 3 much more sophisticated engines. The first is the massive shift to the cloud.
The cloud, of course. But I always thought hospitals were wary of the cloud, for security reasons. Isn't it safer to have patient data in a locked server room in the basement?
That was the thinking maybe 10 years ago. Everyone wanted their data on-premise where they could see it. But that is incredibly expensive and, honestly, a nightmare to maintain and upgrade.
Because you have to do it all yourself.
Right. The logic is completely flipped. The market is moving to cloud-based deployment because it's scalable, and counterintuitively, it's often more secure.
More secure? How?
Well, think about it. Can a local community hospital afford the same level of cybersecurity talent as Amazon or Microsoft or Oracle?
Probably not.
Definitely not. Plus, the real operational benefit is real-time data integration. If you have a network of clinics across a state, the cloud lets a doctor at one clinic instantly see labs done at another. It breaks down those geographic
So
silos.
it's cheaper, it's more connected, it's more secure. That's a pretty strong case. You said 3 engines, though. What's number 2?
Number 2 is the one you've been waiting for, AI and analytics.
Knew it was coming. So is this just a chatbot on the website, or is this AI doing real work?
It's doing some serious heavy lifting. A perfect example is medical image analysis.
You mean reading X-rays, MRIs?
Exactly. A radiologist looks at hundreds, maybe thousands of images a day. It's exhausting, and fatigue can lead to errors. AI-driven predictive analytics can scan those images and flag potential trouble spots for the human expert to review.
So it's not replacing the doctor, it's augmenting them, giving them a second set of digital eyes.
A set of digital eyes that never gets tired. But the report also specifically calls out Gen AI, generative AI.
And how does that fit in? I think of Gen AI as writing essays or creating pictures.
Think about clinician burnout. That image of the doctor typing furiously instead of looking at you, that's a huge problem. Gen AI can summarize a patient's entire 20-year medical history in seconds.
Wow. Instead of a doctor frantically skimming a huge file in an emergency.
Right. Gen AI can give them the key facts instantly. History of arrhythmia, allergic to penicillin. It can even listen to the doctor-patient conversation and auto-draft the clinical notes.
That would be a game changer for doctors. I've read they spend hours every night on what they call pajama time, just catching up on paperwork.
If his can eliminate pajama time, it's worth billions in staff retention alone. That brings us to the third driver.
Which is?
The cold hard cash.
Huh.
The financial imperative. Hospitals have to balance their books, and healthcare costs are surging.
So the software helps them save money.
More like it helps them stop losing money. Through what we call revenue cycle management, it automates the billing process to make sure claims submitted to insurance companies are coded perfectly.
Ah, so it helps fight the insurance claim denial game.
A very high-stakes game. One little coding error can get a multi-thousand-dollar claim rejected. This software makes sure the T's are crossed and the I's are dotted before the bill even goes out.
And I'm guessing the government is pushing for this too.
They're a huge catalyst. Regulatory guidelines are propelling adoption because governments want to track population health. You can't fight a pandemic with data stuck on 1,000 different disconnected servers.
Okay, so we know the what and the why. Let's look at the map. Geographically, who is winning this race?
Well, if you look at the current market share, the undisputed heavyweight champion is North America, specifically the United States.
Not a huge surprise, given the size and complexity of the U.S. healthcare system.
Exactly. It dominates because of strong IT infrastructure, those federal health mandates we mentioned, and the fact that most of the major market players are based there. It's the hub of innovation.
So the U.S. is king of the hill for now, but where's the momentum? Where is the new growth really exploding?
For that, you have to look to the Asia-Pacific region. It's projected to become a $20.54 billion market by 2030, but the key number is its growth rate.
Let me guess, it's higher than 10.6%.
It is. The projected CAGR for Asia-Pacific is 11.9%. It's the fastest growing region in the world.
So fast. Are they just playing catch-up?
It's a few things coming together at once. First, demographics. A rapidly rising geriatric population. More elderly patients mean more chronic diseases, which means more complex data to manage.
You can't manage that with clipboards.
You can.
Yeah.
But you also have massive economic growth and governments in places like China, Japan, and India that are pouring money into upgrading their healthcare infrastructure.
And I imagine they have an advantage.
A huge one. They don't have as many old, clunky legacy systems from the 90s to rip out.
It's like how some countries skipped landline phones and went straight to mobile networks.
That is the perfect analogy. They're able to leapfrog the painful parts and install the newest cloud-native nervous systems from the get-go.
So we know the where. Let's talk about the who. Who are the titans actually building these systems?
The landscape has a few definitive heavy hitters. The two names you will hear over and over again are Epic Systems Corporation and Oracle.
Epic. A doctor I know seems to use Epic and has a strong opinion about it.
They are absolutely dominant, especially in the U.S. They've built a very sticky ecosystem. Oracle is the other giant, especially after they bought Cerner, a huge competitor. But you also have major players like GE Healthcare, Philips, and United Health Group.
So these are big, established companies. This isn't a market where a few people in a garage can disrupt things.
Not at the core infrastructure level, no.
Yes.
The stakes are too high. You can't beta test a system that's keeping people alive.
Okay, so we've painted a pretty compelling picture. Massive growth, smarter tech, better patient outcomes. I have to play devil's advocate here.
Please do.
If this stuff saves money and saves lives, why isn't every single hospital in the world fully upgraded right now? What's the catch?
That is the multi-billion-dollar question, and there are some very real hurdles. The biggest one is what we call the legacy infrastructure problem.
The old systems are just too hard to get rid of.
It's like trying to change the engine of a plane while it's in mid-flight. Hospitals run 24/7. They can't just shut down for a week for a software install.
Right. Sorry, the ER is closed. We're running an update. That's not going to work.
Not at all. So there's huge resistance to overhauling these old systems because the risk of operational disruption, of something going wrong during the switch, is terrifying.
And I'm guessing it's not cheap.
That's restraint number 2. Cost. The high initial investment is staggering. For a mid-sized hospital network, a full overhaul can run into the hundreds of millions of dollars.
Hundreds of millions.
Oh, easily. By the time you factor in the software, the hardware, the consultants, the years of staff training, many hospital boards, which already operate on razor-thin margins, just can't write that check.
It's hard to justify spending that on software when you also need a new MRI machine.
Precisely. And then there are the other challenges. Privacy and security are a constant concern. A patient's health record is worth more on the black market than their credit card number.
And you need the people to run these complex systems, right?
That's the final piece. There is a global shortage of skilled IT professionals who understand both the technology and the unique workflows of a hospital. It's a very specific and very expensive skill set.
So let me see if I can sum this up. HIS is the digital nervous system of healthcare, a market that's about to explode to nearly $117 billion.
That's right.
It's being driven by the cloud making data accessible everywhere and AI making sense of all that data. The US is the current leader, but Asia is the future, leapfrogging old tech.
A perfect summary.
But the whole transformation is being held back by the sheer cost, risk, and complexity of ripping out the old wires while the lights have to stay on.
It's a necessary evolution, but it's a very painful one for the industry.
It really is a fascinating space. So I'll leave you with the final word. What's the one thought we should be mulling over as we leave this conversation?
Well, we talked about Gen AI summarizing records and AI suggesting diagnoses. As these systems ingest more and more data, millions of patient outcomes, genetic codes, real-time vital signs, we are getting very close to a point where the system itself might statistically know more about a patient's probable health future than the human doctor standing in the room.
That is a heavy thought.
It raises a fundamental question for the future of medicine. At what point does the nervous system become the decision maker? If the AI says a treatment has a 99% success rate and the doctor's intuition says otherwise, who do you trust?
The calculation of the machine versus the wisdom of the human? Wow, that's a topic for a whole other deep dive. Thank you for this. It was incredibly insightful.
My pleasure.
And to you listening, thank you for joining us on this look into the $116 billion future of healthcare. Stay curious.